Hey everyone, it's Erin from Blush Aesthetics, and today we're going to talk about healing your perioral resurfacing area that you received at Blush Aesthetics. So I always say, it's kind of like HGTV, you can't have reno day until you have demo day. And so the first day is definitely the, I would say, most challenging because you just got the treatment done. There is some oozing, there can be some mild bleeding through the first 24 hours in that area. So you have to remember that we are trying to smooth down an area that has become a little bit, I would say, more challenging with regard to the skin texture, the skin tone, and those deep lines and wrinkles. So we are really trying to even those out and create much smoother skin in that area. So again, oozing, bleeding, very common in those first, I would say 24 to 36 hours after you get the treatment done. Tonight, what you're going to want to do after you come home after your treatment is before bed, you're going to want to make sure that you get all of that crusting off as you wash your face. So that might mean a couple washings. That might mean taking a warm washcloth and just kind of loosening it up. You might need that white vinegar soak ingredient that is on your post-care list, where you just add a couple tablespoons of white vinegar to some warm water if it's become really stuck on, and that can help you just kind of get all of that off. We want to make sure that we are moving that crusting off of the skin so that it can heal better. So day one, that's what you're going to do right before bed, and then you're going to put the healing balm on. This can be an Aquaphor, this can be Hydro Balm, Soothe and Protect. There's a couple different brands that we provide, and in a pinch, if you run out of it, you can always get Aquaphor from the grocery store. Day two, so the day after you get the treatment done, swelling is something that is considerable usually in this time, especially if you got an all-over face treatment, which we don't just isolate one area to treat. It's always going to be a better result if we're treating everything all together. And so we do see swelling as a significant issue that people get. And I say issue, but really it's pretty much everybody. It just becomes, I think, when you're looking in the mirror, very alarming sometimes. And so folks can call in if you feel like you're having a lot of swelling and you'd like something to, kind of help with that. We can call you in a prescription if that's the case. But for most individuals, that swelling is going to go away within those first 3 days. So it's going to be the worst the morning you wake up the next day, which most likely you're probably coming to our office or at least sending us pictures so we can see how you're doing. And then that typically resolves by about 72 hours. You will get that skin also continuing to peel and to heal and some pinkness in that area. The pinkness is most, I would say, prominent in those first 2 weeks after you get the procedure done. But once you start having healthy skin replace some of that area, and it might be 1 or 2 peeling processes that happen in that first week or so, but once you have some healthy skin there, yes, it's still pink, but you can absolutely cover it up with a little bit of tinted moisturizer or SPF. That's not a problem at all. As you move along in the healing process, know that the longer you are pink, the better it is, because the more collagen that you're building there and the more smoothing that we're going to get. So if you are having pinkness, that is very normal. It's very common. You can absolutely cover it up. By the time we get to, I would say, week 5, week 6 in the healing process, if you're still pink and it's bothersome to you, we can always intervene with a couple different treatments we have in office. So you just let us know at that point that you would like something to help with that. Usually it's at your dermaplane appointment. We take a look, make sure everything's looking okay, healing properly, and then we can go ahead and schedule you for a treatment for the pinkness at that time. What you're going to continue to see, though, in those first couple days after you have this treatment done is it just requires intensive care of you washing and then moisturizing with the balm, that barrier balm that you have, and then washing throughout the day as you need it, as you start seeing that crusting build up. So it might be 2 or 3 face washings that you're doing through the day and then reapplying the balm. That is super common. The number one, I would say, phone call we get about resurfacing is typically about the oozing, which again is very normal for the first 24 to 36 hours. Little bit of bleeding, little bit of oozing from that area. And then again, we want to make sure we're getting all of that crust off very gently, and then reapplying the balm so that it continues to heal well throughout the process. If you have any questions for us, you're always welcome to text us. You're welcome to send us pictures. we can help you through the process. We do this alongside you. You're not just out there, doing it on your own. So please let us know if there's anything that we can help you with along the way. And happy healing with your laser.